is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, 94.3 FM fans. Today in studio, we have the famous Dr. Pannozzo. and Doc, you're sitting in the captain's seat today because Mr. Les Mayer is on vacation. Do you think he's going to call us? Probably not. What do you think?
I wouldn't call. If I was on vacation, I wouldn't call you.
I know. He's not going to call me. But, and today we have we're fortunate enough to have Dr. Eihart behind the glass, Mr. Nutter.
Good morning, guys.
Like your headset.
Well, thank you.
Very good. Hey, Doc, we were talking about a little bit before we went on the air about the stuff that you're going to be doing very soon, a reality show. And the reason that you're doing this reality show is because you want to show actually what's going on behind the curtains. You know, we sit here every Sunday now for 3 years talking about it, but you're actually going to show it.
Yep.
How do you feel about that?
Well, it's an educational deal. It's we started out as an educational program, and that's a little bit further.
It's a lot further.
It's going to get the doctors involved.
Yeah, well, it's going to get a lot of people involved because you're actually going to show how you get it done. And this is going to be live patients. Nobody's been paid for this, right?
No, these are patients right out of the practice, and they could refuse to be on camera, or they could accept it, and they sign for it. And I don't know what they say because they say it in private to the camera. So, but I know that the re-examination that we do is improved, and that's what they're going to discuss. So these are their own words, no scripting or anything like that.
Have you had anybody who has agreed to do this not be cured?
No.
Everybody that you had so far? Because I know that the filming of the reality, which is separate from what we're doing here today, and hopefully when we get that material, this conversation will lead into watching what's going on in the office. I noticed that a lot of people that are in your waiting room, because I've gone there a few times to see you, a lot are new, and they're like, can anybody tell me what I got myself into? But they're there. They're there because they're in pain, and they heard about the show and about you through a number of sources. I was curious to find out, what is the conversation when you meet somebody new and they tell you their pain? How do you get them to relax? Because they all come out smiling, I guess, because they're not hurting, correct?
It's the art of medicine, I guess. You know, there's a science in medicine, and there is an art, and you have to calm people down, because they don't know what to expect. They think they're going to die today, but that is not true. Pain comes from a very small ligament usually, and once they understand that, they calm right down. Then we go through the process of localization and to show them on the film where it is, and then I offer to cure it, and they usually say yes. Sometimes they don't, but that's pretty rare. And then we take care of it, and then in 2-3 minutes, 5 minutes, they come out and they talk to the camera, and they're cured.
And when you analyze, I noticed seeing some of the footage. Like you had a young man who was a pitcher, which I was really, really impressed with.
Oh, the young kid, 16 years old.
And he was told by his team for 6 weeks not to pitch.
Yeah.
And you had him doing the motion after you took care of the problem.
Right.
And the father was so amazed. If you look at him in the video, he didn't know what to think. He thought he walked into the Twilight Zone. You know, because he's looking at his son doing this motion. Now, you got to understand the mentality. He's been sitting for 6 weeks. And you're walking around like, this is not a big deal. This is just taken care of. So the psychology of what you do is just as important as what you treat them for, yeah?
Yeah, you have to be very positive about everything. Pain is very difficult for people, some people, and you have to know that. But the best way to get them to calm down is get a result for them.
That's right.
Yeah, and explain what it is, what you're going to do, and then do it. And so that's what we're going to show on the film, on movies. Say movies? What do we say about that?
Well, Les doesn't want me to
show.
call it a reality show because he
Yeah.
doesn't think it's a reality show, because reality shows are kind of,
Well, what's out there is scripted, but
yeah.
ours
This is
isn't.
not. You don't
No.
know what you're going to get
That's
with
right.
what you do. And Nutter,
Yes.
Dr. Ihart, you have kids, don't you?
Correct. I have two.
Isn't it amazing that if your kids get hurt or they're in pain or something's going on and you feel helpless, what's the first thing you end up doing?
Going to the doctor, the ER.
The ER, right?
Yeah.
Oh, yeah.
Okay, and then you take them to the ER, you have to wait about 6 days.
Yeah.
And they grow a mustache by the time they're seen.
That's true.
And 9 out of 10 times, over time, maybe a few weeks, they get better, yes?
Yeah, usually they just send us home, prescribe them something, and we're on our way, and we really don't know if that's, it's going to help them or not,
Well, I would tell you it's not, because they're not trained in how to treat these things.
That's right.
Emergency room. They're trained to keep you alive, not to take care of a painful shoulder.
Yeah.
I mean, in deference to them, let's not ask people to do more than they can do.
Well, Doc, it's strange that you say that, because this kid that was pitching will still be sitting if he didn't come see you.
Yeah, most of those are not what they tell you they are, like a rip, a tear. These are sprains only. We got to get back to the old terminology where you're talking about a sprain. Sprain for ligaments and a strain for muscle. And that's the proper terminology. Now, when you talk about a tear this, a tear that, I think they're read, especially MRIs, are read for surgeons. Because they will repair a tear. But how in the world would you get a tear?
How can you see a tear?
You can't. It's very difficult, and I think they're making it up. Tell you, that's my opinion.
Well, Doc, it's all
But
on.
if you want to come to me right after the injury,
Right.
well, you can do that because we know how to do it.
Now, I got a question for
Yes.
you. After the injury, there's swelling. Can you still take care of them with all that swelling?
We don't want the swelling, so it's a natural thing.
Right.
Swelling's a natural thing. But when you come to me first, we take that inflammation out of there quick. And so in a day, you're pitching again.
So that swelling, because you're seeing the person, is going to be reduced when you're finished with them, yeah?
Oh, yeah, it goes right away. Yeah.
See, this is the thing, Doc, that so many people, that is so unnatural.
Yeah.
But it works. And when people they got to get over the fact that because you're different doesn't mean you're bad. You understand? People think that because you're different, it can't be.
Well, I think the pressures come from people who are not trained, the trainers, the coaches. They're just led like sheep. This is what you do, and they're afraid to use their head. But in my case, I use my head. These things don't work. The faster you get to these injuries and treated, the better it is for everybody. It's for the player, that person, and the organization also. So you want to get to it really quick.
Right.
Really quick.
Now, somebody has an injury in the shoulder, a pitcher or something like that, you take care of them. Is there going to be soreness after you take care of them?
Well, a little bit, but usually not. They should pitch the next day.
Really? That quick? Mm-hmm. And the strength in the area doesn't get reduced because of the injury or the swelling?
Well, if you get it quick, if you treat the injury quickly, there is no weakness. Because the weakness that you get is pain inhibition. In other words, it's painful, that's why you're weak.
Right.
But you're not really weak. There's no weakness of the muscle. You can get very technical with this stuff, but usually a pain is due to a ligament sprain, and not muscle. So you can take care of the sprain, and then the strength comes back.
Now, we're here speaking with Dr. Pannozzo, and we are going over from the beginning again to what you do, because you have a new market up in Boston.
Oh, Boston.
And everybody up there is like scratching their heads wondering what is going on. Even the questions that we're sending and the ones that are coming back, they're answering the questions with questions, because they haven't seen enough of the footage of what you do, and how now it's going to be not only what you do, like this show says, but it's going to be how you do it.
It's also the thinking process that we go through. And you see it all right there in front of you.
Right.
And you may not follow it because you need a little bit of background to understand what the questions are. So all the questions we ask people are yes or no's. And they are point specific to the anatomy that I'm thinking about.
Right.
So the question means a piece of anatomy.
Right.
So it depends on how you answer that question. If it's yes, that's painful, and then we know where it is just like that really quickly. And if you say no, then we go another route. So we ask other questions. But each one is aimed at a specific structure in the body, each question. So you analyze it, and it's like I'm a computer, I'm a computer. I'm sitting there. Am I an apple? Yes, I'm an apple.
You're the Mac.
He's the Mac.
Mac
Yeah,
Pro,
that's very
Mac
good.
Pro.
He's the Mac.
So you're calculating all the time. As a matter of fact, the good doctors will always calculate from the first time they see you coming out of that waiting room. They will already have started calculating your problem. And then they ask the questions to straighten it out. Then they do a specific film for that. And then we offer the treatment for it.
Right. 1-800-889-0267. 1-800-889-0267. You want to call and chat, rap with the with Dr.
What's
Pannozzo.
been terrific, though, is the ringing in the ears.
I wanted to talk to you about
Oh, it is so good. I can't believe it.
You guys filmed a piece that I must have watched 4 times by now. And I kept watching it because it was a female, and she described it as this sound. And I sat there and I wondered, how can anybody have this for months and still stay sane? It's like having a butterfly or a bug in your ear.
That would drive me crazy.
Drive me nuts.
Yeah.
And she came and you explained to her, and if you look at the look on her face when you told her what it was all about.
Oh, that she's sitting on a table?
Yes.
And we're talking, and
Yes.
she says, oh, it's gone.
She goes, and this
Priceless,
and
huh?
she wasn't paid.
Yeah.
We had nothing
Oh,
to do
no,
with that.
no. Nobody's paid for it.
She was
you know who gets
amazed.
paid in that office?
Oh, good.
Me.
That's right. You get paid for doing the shots. But she was so amazed at the ringing. I mean, think about it. If you had a bee in your ear for a few months, because she said a few months, and all of a sudden it goes away, wouldn't you be delighted?
Oh yeah. I mean, unless it was drowning out other noises like my wife or my kids,
Oh,
then
that's a good thing.
I would want that.
We had a big executive for automobile companies around here. Had that for 20 years, and he wanted to kill himself. I mean, this is
Oh my
him
God.
telling me it was
Are you
that bad.
kidding me?
Now, this guy has a responsible position to sell cars. He'll know if he's listening. He'll know. I'm not going to tell
That's
you.
right.
his
Give
name.
us a call, 1-800-889-0267.
But he calls me up and he says, "I want to come in. I want to get the shot again." And I said, "This is really unusual." He said, "But I'm getting 2 or 3 days relief."
Okay, now this is a
See?
twist.
That is really good. So any improvement, then you could do it. There's nothing that says that you can't approach it more than one time, because what we're dealing with is scar tissue. I call it scar tissue, inflammation in a particular structure at the top of the head, the top of the neck. That's where this comes from, ringing. And what you're hearing is the movement of the COC1. But it's not a hearing problem, and hearing tests have nothing to do with it. You could have good hearing or not; it doesn't matter.
You get a number of issues in that particular region. So is that region susceptible to having inflammation, to being injured?
Extremely susceptible. That's
Susceptible. That's the only word I can say in English.
susceptible.
Yeah.
And that's what. And that's what we're talking about on concussion with the football players.
That's right.
They're missing it completely.
Isn't that amazing? If they would just take a timeout.
I even saw a doctor put something on TV, and I was watching it, and I don't know what it is, but something drags me to that. My finger goes to these programs. And I mean, the whole thing was ridiculous, but I sat there watching it, and he was talking about the draining of fluid from the brain.
Draining of fluid from,
the brain.
Okay.
I mean, the guy was totally dumb. I mean, this is the dumbest thing.
Well, he has a philosophy, Doc.
Well,
it may be,
he's trying to prove the philosophy. Yeah.
it may be a little bit off.
But see, we're getting the results right now.
But this is just it.
And that's
this is,
why
they should take a look at
Yeah,
this.
that's why we know it works. And they're not getting it right now, and they're making a lot of money on it. They're treating these guys, you know.
Now, you know something.
I think it's terrible.
You and I
If
had
you don't know what to do, you shouldn't do it.
You and I had a conversation one day out here in iHeart Media, and we talked about the birth of a child through the canal. And you know, it's funny, and I'm not saying that Dr. Pannozzo was right about everything. Right? You know, it'd be foolish for me to say that. But we talked about the yanking of a child through the canal. Mm-hmm. You know, my son was brought out with forceps. Gio was brought out from the shoulders, and there was always that yanking. Yep. Which would explain a lot about this sensitive area that gets a ton of damage. Mm-hmm. You know what I'm saying, Doc? And you said to me, I bet you that I could show you with all that pulling how people grow up having problems in that area. And that's what's happening.
Right.
Now, I'm not saying that that is the reason, because I know there are people out there that says, oh, you can't blame all these diseases and all that on that. But you can.
They're not diseases; they're conditions.
Conditions.
And which one are we talking about?
Well, I don't want to talk about any specific.
There's one where kids screaming.
Yes.
That's not true.
Yes.
That doesn't happen.
But the bottom line here is when you're yanking out of the canal to get that child out of there.
Yeah, you're pulling on the neck, so you have to be able to. You have to be able to put your hand up where the shoulder is. And I'm no expert. I had 40 deliveries though.
You did?
40, yeah.
Did you yank any of them?
No. You know, there's a lot of birth injuries, and they come from this yanking.
Yes.
So you have to be very careful. All you do is ease off and let the body, the mother, push it out. And all you have to do is push the shoulder down, and it comes right out.
And everybody, like doctors that I've spoken to, says, yeah, Freddy, when you yank, it all heals. No. How do they know that?
No, the mother heals, but not the kid.
That's right. Or any of us. I mean, I was yanked. I asked my mother. I called her in Puerto Rico. I said, Mom, when I was born, was I yanked? She said, yeah. They had to yank you out of there.
We don't, we really don't know what's going on there.
But you look at their sensitive region with the ringing of the ears and all the other, the migraines, all that is in that, concussions.
Yeah, autism.
I didn't want to say that.
Is my favorite thing that comes from this
Doc, I didn't
birth
want
injury.
to say that.
Birth injury is, I'm telling you, there is no other answer. There is no disease there. It's a condition, and they're missing it completely. There's a lot of money in it, state and federal funds for schools.
I wanted to stay away from this
and all
subject.
that. I tell people, don't let the money drag you into it. Get the best care you can get for your kid. Don't worry about that other stuff.
And the funny thing here is that Dr. Pannozzo is asking for it to be investigated. Let's take a look at it. He's not saying, well, he probably will say it, but I'm not going to let him. He's not saying that that is the problem where we have to find the cure, but he's saying it's worth a look at. Just like you did with the ACL, just like you. I got one. Are you a football fan, Dr. Ihart?
Well, yes, I am.
Who's your favorite team?
The Dallas Cowboys.
I hate you, Dr. Ihart.
I hate you too.
There you go. I'm a Jets fan, okay?
Oh, I'm sorry.
And so am I. Condolences. And they just released a running back, Doc, because he has a hamstring for 8 weeks. He can't practice. You know what I'm talking about?
No, I haven't been up on the Jets.
We're not going to use his name, but he's been eliminated. They have a running back from the Bears called Forts that also had a hamstring, self-inflicted hamstring injury when he was running, right? Now, these are running backs. They carry the ball. They get hit in the hips, in the waist area constantly, brutally. I mean, 300 pounds, 380 pounds on you hurts.
I think that the injury actually comes from the method of exercise they use.
Well, it could be that too.
When you take your leg and you throw it over one side and you hear that cracking, that causes hamstring symptoms.
Yes, and they can't cure it.
And that
because they're looking in the wrong place.
They keep doing it.
Doc, they're giving him medication in the hammy.
Oh no!
But that's not where the injury is.
No.
That's the problem.
You have to be able to diagnose that, and their exercise is bad. They shouldn't be doing that, and the treatments are non-specific. So that's what I describe it.
But these guys are being released. They're not playing.
Well, it's too bad. Why don't they come and see me? I mean,
Well, I'm hoping that somebody will watch the show in New York from the team. Now, we heard from somebody who deals with teams that the players can come to see you. They can.
They could, yeah.
And there is no anti-doping problem. We've had that checked out. And if you are an NFL player and you want to talk to your agent, 561-381-5800 is the number. And we'll be happy to put that together. But hamstrings, hips, the torque that's required to play in the NFL, all of that can be looked at by Dr. Pannozzo, because that's a sport that deals with pain, Doc. That is the difference. All pain.
The difference is it's a physics problem, which means weight bearing in motion. So a building bears weight, or a pier does, something, but it's not in motion. So it's a new way of thinking about it. So it's weight bearing in motion. So you have to know the anatomy, how it's being used, how it's bearing weight.
Right.
And once you understand that, then you can fix it. That's why we get good results.
That's right. And the difference here is that if you're going to sit on the bench for 6 weeks, now that kid, that pitcher, and I wish that we had that film ready to go today, because I would love to show it. I mean, this kid was actually throwing, and he looked at his father and says, "Dad," and he didn't know what to say. The kid was like, "What do I do here?" They told me he couldn't move his arm when he came in, right, Doc?
Yeah, right.
And he's like, and so the doc says, "Are you pain free?" He says, "Well, it's not completely gone." He says, "But I can move it again."
That's good.
And he was shocked. You could see his eyeballs were this big, you know. And I think that players that are not playing have absolutely nothing to lose, because you're not denying entry into the NFL or anybody else.
You can't get worse.
That's right. And if sitting is sitting, and if you're going to sit, what
It's not
difference
good
is
for anybody. It's not good for the game. It's not good for the players. It's not good for the owners. It's not good for anybody to have a player like that sit on the bench with nothing to and not knowing what to do. I mean, they're admitting they don't know what to do. That's why he's on the bench.
That's right.
Why do they look
right.
in the mirror and say, "I don't know what to do. I got to find somebody who does," instead of sitting on the bench?
And what did they tell that kid? Ice
Yeah.
and compression, right?
Yeah.
That was what
Don't
we
move
used
it.
to
Just hold it like this. Put ice on it. I mean, that's
That's how we used to take care of injuries. Lots of ice.
Yeah, you have to know the anatomy in detail and what it does before you can treat this stuff. And I have done that. That's why I can talk like that. Yes, that's why I can
That's
talk
what
like
you can talk
that.
about. Hey, Doc, when you have a sprain and you wrap it in an ace bandage, for some reason, it feels better. Doesn't mean it's healing. It just feels better. Why is that?
I don't know.
Is it psychological?
Uh,
Because it's not getting any better. You take the bandage off, it hurts like hell.
yeah, that could be part of it. Yeah.
So, all right, you want to do some questions?
It stops the motion is what it does. When you wrap something, it stops motion. It's
Okay.
the motion that hurts. You know,
Okay, that makes sense.
when I talk about a pain, I'm talking about a pain produced by motion. If you can have a motion with no pain, then you have no pain. So if you have a pain and you have normal motion, you have no pain.
Right.
A pain is always going to limit your activity. So that's how you diagnose that.
That's like
So a pain is called an inability to stretch.
to stretch.
And that's my definition of
That's
it.
what Les is always saying. That's the
Yeah.
one line that Les learned in the show. But that's like a golfer. You take a golfer, right? You have to have certain parts of your body play
Yeah,
this thing.
right.
You know, if I don't play golf for a couple of weeks and I go on and hit a bucket of balls, the next day I can't walk. I can't move. There's pain everywhere.
Well, your muscle memory
It's gone.
Yeah.
My muscle forgot all about it.
We can guarantee that we can get you the yardage you want because we know what causes the pain in the golf swing. So again, you have to know your stuff before you can talk like
But
this.
I got a question for you. If a golfer comes to see you, and if he waits long enough, let's say he waits 2 months, and that pain becomes tolerable. I'm not going to say it goes away, but whatever the problem's there. And he's changed his stroke to compensate for it. Of course, you know that's going to happen. Or he re-injures himself and he comes to see you. You give him the opportunity to get back out there and swing the way he was before the injury?
You have to go back to a normal swing. You can't have a swing that's adjusted for a pain.
Right.
It's like a limp. You know, the reason you have a limp is because you're taking the weight off of a part of the body that hurts. So you limp. The same thing with the golf swing. While you're swinging, you're going to get a pain there, and you're not going to move after that. And so the pain becomes scar tissue after that. So it reduces your range of motion. Now, who has that? Famous golfer?
Oh, yeah, Tiger. He's done. He's done, Doc.
It's too bad because we can get him back right on that course in 2 weeks. And take me up on it. It's true.
You know, it's really funny because we talk about golfers, we talk about pro athletes. Waitress in a diner who works 8 hours, 10 hours on her feet all day, 6 days a week. Tough business. And there's all sorts of stuff going on, yes? Her knees.
Absolutely, sure.
Her hips, everything else. Just a common person that is in pain. Come see you. Now, it doesn't mean that you're never going to have a pain again. I don't want people, I go to eat with Linda. We go to different restaurants and stuff. Hey, aren't you the guy on that Pannozzo show? Yeah. Well, how are you going to say that I'm never going to have pain? I'm not saying you're never going to have pain. You may have pain in a different part of your body, very close to where he treated you. But what I have never, ever, ever understood is how quickly you can diagnose what's going on in somebody. That's what amazes me more than anything else.
Well, out of all these years, I've seen everything. And
but it's amazing because it repeats itself over and over again, and you're there quick.
But it's true what you said. They're misinterpreting. First of all, you need a reduced motion to have a pain, or a pain will reduce your motion.
Right.
Now, once that motion comes back after treatment, that pain is not coming back. That pain is gone and will not come back. Another pain could come back.
Right.
Could come in, but not that particular one we treated. And it's true. People say, how is that possible? Well, it's possible because you're treating a ligament structure that becomes normal. No pain. So then that allows you to hurt something else, but not the same thing.
And Doc, let's also say that when you treat them, if they want to go to rehab, whatever they want to do, they can do. I mean, it makes no difference. What I know. But if they want to, they feel that they have to get that area, like if they had it for 2 months and they want to re-strengthen the area, make it stronger. We're not going to get into the politics of that. But they can. They can do that. The bottom line here is that you're going to give them a quick antidote, no meds, no operation, none of that stuff, and you're going to take care of the issue. And that's what they have to come to grips with. It does work. It's here to stay. It ain't going anywhere.
Yeah, the rehab is not a diagnostic thing.
That's right.
It's not a scientific thing.
No, it's not.
They are going to do whatever they think to do. But in order to get the pain out of there, for sure, is very scientific and state of the art, and that's what we're offering. So if people out there take advantage of it, take advantage of it.
You take a look. You go to Dr. Ihart over here. You have a pain in your shoulder, and the surgeon says, "Well, I'm going to send you to rehab, physical therapist. Yeah. If that doesn't work, we're going to have to operate."
Yeah.
So they send you to physical therapist where they put you like a pretzel. So what do you think? You think you're going to get better? First of all, when they touch you, you're going to scream. Then they're going to say, "We got to work through it."
Right.
So they loosey-goosey you up, and they put cold compresses, hot compresses, the same stuff we used to do.
Well, the deal is that they're stretching a painful structure.
Yes.
You can't stretch a painful structure. It hurts.
It hurts.
So what we do is knock that pain down and get the motion back so you can stretch it.
That's right.
So there's a big difference in the approach and the reasoning process. You got to listen to the program because we're giving you a reasoning process. You have to understand how the thing works before you can treat it. And so if you're on the bench, obviously you don't know how to treat it, right?
That's right. Well, I had somebody who was in a car accident, and she got whiplash. And when we went to the chiropractor, because she gets 20 visits from the chiropractor, and on the wall there was a big sign, Doc, that said, "No pain, no gain."
We don't kind of like that. Do you have questions there?
Yes, we do.
Oh, let's get to we got a phone call.
Oh, okay.
We got Mark from Palm Beach.
Mark, you're on the air.
Mark.
Hi, I have a question. Good morning, doctor. I have a question. My wife, I would say about a month ago, after several MRIs, was given an epidural. And she seems to be recovering, but I was wondering if the doctor could explain the difference between that type of procedure where they had the fluoroscope and they did the injection versus what he would do. I think you call it like a pain block.
No, we actually know what causes the pain, and we treat it directly. So epidurals, when they use that, they don't know what's causing that pain. It's too general.
As an epidural, they're just giving her, knocking out the pain from her brain, no?
Well, epidural, that's all it does. It numbs everything.
Numbs everything.
That's why you can't walk for a while.
Yeah.
It numbs out everything, and what good is that? You want the specific area treated, then you get up and walk home. I mean,
Hey, Doc,
that's my
when
opinion.
you're giving birth, or when a woman's giving birth, don't they put an epidural in the spine?
Yeah.
And they tell you, because one of my ex-wives had it done.
My wife had it also.
And they tell you, they make you sign something that says you can get paralyzed. Did you read it?
That was probably the fine print we skipped across.
Or they're in such
Everybody
pain, they
does.
want it done. But Mark, that's a real interesting concept that what they're doing is...
You can't really get paralyzed for long term. It's about an hour.
Yeah, well, you know what? If I'm paralyzed for a minute, I guess...
Anyway, Mark, did you get the answer?
So Mark, do
I
you understand?
think so. I was just trying, because from what I've been told, that they don't last for forever, and certainly I'm more
But you're
interested
not.
in a permanent fix.
Right.
But you understand, Mark, you're not treating the source of the pain.
Right.
It's too general.
Right. Even though that they were looking at quote unquote the MRIs, where they use that to aid them in finding where to make the injection.
Well, if that was true, why do they do something general like an epidural?
Right. They give me...
That doesn't make any sense.
That's a pain blocker to the brain.
Yeah, it has nothing to do with the source of pain. They don't know where it is. That's why they do an epidural.
Correct. Dr. Pannozzo will go right to where her problem
right.
is.
But I know where it is.
Right.
And we worked this out a long time ago.
Yep. He goes right to the source of the pain, and he removes the source of the
And it does
pain.
not, right, it does not come back.
And it doesn't come back, and it has nothing to do with giving her a mental or brain blocker.
Not only that, we do a scenario.
That's right.
For that, I'm looking at Mark.
What does that exactly mean?
The scenario means where that pain is, how you got it, and what it takes to take care of it. In other words, it's the whole deal. It's not using an MRI that says a bunch of things. You ever read an MRI?
No, you don't
No.
let me read them, Doc.
I mean, it doesn't tell you anything. It says the same thing on every level. And so you say, which one's causing the pain?
Right.
They don't really know.
They
because-
don't. So they gave her a general epidural just to knock out the
That's
pain
right.
so she
But-
can feel
But we
better.
don't use MRIs. We have our own standards that we use film-wise in the office. And
Could you give me an idea about what an office visit might cost for something like that?
Where was her pain? Where was the pain?
I'm sorry?
Where was her pain, Mark?
It was in her hip and her knees, and then eventually in her lower back.
was it down the side of the leg?
I don't believe it was, no. But I know in the morning she could barely get out of bed. Get out of bed.
Well, that's usually a 4 or 5 level. So we would look at
Lower back?
a lower back could do that. And yeah, that's treatable one day. No, not a problem.
And the cost more or less, Doc?
Well, the cost is usually picked up by insurance if you have it.
And if you had to pay cash?
Otherwise, it's like $450.
There you go, Mark.
But that's a guaranteed work now. And if it takes one
And no
visit,
epidurals.
Completely.
that's good. Or 2 visits, that's still okay. You pay one price.
Correct. He has to find it in her lower back, and you got an idea of what it would cost.
We're going to that more and more because insurance companies are mandated not to pay. And we've talked about this often. It's
Right.
getting worse and worse.
Well, Obamacare is changing, is making everything worse.
Everything is bad. So if you can come in and the what do you call the amount you have to pay before your insurance kicks in,
Or the
not the
deductible.
copay, the deductible.
Deductibles.
You might as well just pay it cash and come and see me. We fix it. And then don't bother with your insurance because
I have
we're not gonna
I
pay
have a
anyway.
question for Mark. Mark, how many times did you visit the doctor before they gave her the epidural?
Well, she had an MRI on her hip. She had an MRI on her knee, she had eventually an MRI on her lower spine. So those were just 3 visits to get results from.
Well, you see, you shouldn't examine the knee. If it's normal, you don't need an MRI of the knee. Examine the hip. If it's normal, you don't need an MRI of that. So they're using the system. So you got to be careful.
Right.
You have to know a lot when you seek medical care.
Right.
You really do. It's the same thing with the managing your money. You better know what you're talking about.
That's right.
Or else you're going to lose it.
Now, Mark, I'm going to share real quick with you. When Dr. Pannozzo helped me, I had pain in my ankle, in my knee, and my feet. I was a catcher, and I got run over a lot. And Pannozzo looked at my hip and says, everybody's looking in the wrong place, Freddy. It's in your hip. And I'm going to tell you something, my friend. 2 visits, and I didn't have to spend MRI money. I didn't have to have any kind of stuff like that. And I'm good as new. And I was in pain for many, many years before I met him. So just a word to the wise. Is she better now?
I wouldn't say she's made any type of recovery, but I mean, she can certainly get up and walk around, but walking distances and stuff like that is definitely a problem.
Yeah, well.
Listen, I'm going to give you his number. Write it down, 561-381-5800. He's on Linton off of Military. Where are you calling from, Mark?
Palm Beach County.
It's not that far.
Not very far away.
Not far away. It's worth the visit, and then you can call us back. Let us know how she's feeling. But you're gonna be amazed, like I was.
All right. Well, thank you very much.
Thank you for the call, Mark.
Thanks.
All right. Bye.
1-800-889-0267. Share a story. Now there you go. There's an interesting concept. They did all these tests, Doc. Right?
Right.
And they give her a brain freeze. She can't get out of bed. It's been weeks, months, whatever it is. 3 visits, 3 MRIs.
Well,
Epidural's not cheap either.
Well, they're working towards a surgery. So you have to be careful. If you're going to go to an orthopedic surgeon or a neurosurgeon, you know what the end result is probably going to be.
That's right.
So if you come into my office, you know there's no surgery there. So there's no question you're not getting a surgery.
That's right.
And if they send you to the PT, which means they dropped your care, I mean, why aren't these doctors taking care of that instead of sending you away like that? I do all my own work. You know, you don't find a PT in my office or anybody else but me. You find me, you get a doctor's impression, you get a doctor treatment. What more do you want? I mean, that's quality.
Doc, listen, I went to the Volkswagen dealership and bought a car for my daughter the other day, right? You know what they had in there? A masseuse. You get a free massage.
Well, buying a car is stressful.
It is. That's what their whole.
Sign papers
But my
all day.
goodness, you should have seen the line was around the block. They had 2 lines. They had the ones that were buying, and the ones that were kicking the tires. So Linda went. She got a massage. I think we should put a masseuse in your office.
Now, is it unlimited massages? Because then I know where Linda's at right now.
It's a 15-minute. No, it's unlimited. You can go as many times as you
she's
want.
probably there right now getting a massage.
Who knows? All right, Doc, I got a couple of questions here for you. And I'm looking at the ones that I'm trying to pronounce some of this stuff. A lot of people sent in what they've been diagnosed with. So don't lose your cool, because it doesn't mean that this is real. This is just what they've been told, okay? Zachary from New York City writes, I have been diagnosed with ankylosing spondylitis.
Ankylosing spondylitis.
That too.
Yeah.
A chronic inflammation disorder unknown of origin that affects the spine, the sternum, and large joints in the body. Inflammation of the spine is created. A decreased spine motion resulting from the inflammation happens. My question is, can you help me with my crippling disease?
Yes. What that is inflammation of the ligament structure between the bones. It solidifies. It's very stiff and painful, and you can't move it. And you end up getting calcium formation in that ligament as a repair. So first of all, you have no motion after that. I mean, it's a terrible, terrible disease. I remember we had a fellow come in to see me that was in a chair. Only 32 years old. He was in a chair. And when he stood up, he looked like he was still in the chair.
Really?
Knees bent. So eventually we treated all that, and he eventually walked.
He had this kind of disease?
Ankylosing spondylitis, yeah.
And Doc, how do they treat that now? How is a
Well,
doctor
I don't know
treat
how they treat it. Obviously, they don't treat it. But the way I treat it is we select the ligament that is painful of that day, and we just put an anti-inflammatory in it.
Is it more than one ligament?
It's every ligament,
Every ligament.
all of them.
So I can understand why this gentleman is still in pain.
Yeah.
That's a process. That's not going to happen in one visit.
Yeah. Well, on our approach, we use the area that's treated doesn't come back right away.
Gotcha.
So you can always go to the next worst one.
Gotcha.
And eventually you improve your standard of living, at least temporarily.
Now, I heard you talk to a patient one time, and you said we're going to chase that pain.
That's right.
What does that mean, Doc?
Chase the source of the pain.
Chase the source
In
of
other
the
words,
pain.
if you have 3 or 4 pains, we can only treat the worst one we see, because that's all we know, the worst one. So we treat that. Next time it's the second worst one and the third worst one. If you have a curvature or scoliosis, you're going to have this problem.
Right. You have to chase that.
You have to chase
It
it.
takes a little bit of time.
It takes time.
But it didn't take one day to get the scoliosis either.
These are all injuries of years ago, and these 15-year-old girls who have this, don't wait. Come in and get it fixed. You can get it fixed really cheaply and efficiently. And it's not painful at all. No exercises, nothing. We do it all for you. And if you're going to wait till you're 40 years old, it's already late.
Really?
Late. Very
It gets
late.
harder to fix? But it can be fixed, because you
It
fix
can
it
be
70.
fixed, but it's more tedious
Takes more
to do
work,
it
yeah.
the older you get.
Takes
Now,
more
we have
work.
an 80-year-old women that have this scoliosis, and they're all straightening out. But it takes forever.
Takes time.
to do it.
Yeah. You also said to me when you were dealing with a Hall of Fame hockey player that sometimes getting into certain areas in the hip joint, the hip area, is tricky because of how the curvature is.
Yes, and you have to know how to diagnose that. Now remember, these are pretty big people.
Yes, he's huge.
So the ligament structure causing that could be large, and you have to chase it around, chasing it again. It's a good term to use in your mind, because it explains a lot. In order to chase it, you have to be able to diagnose it.
Right.
So when I say we're going to chase this pain, that means we're going to know where it is less and less and less, and fix it.
And it's important that we say these things, because people that are bigger and have hip issues, sometimes it takes a little more work to get to that place. Because
Yeah,
it's a
and
little
it's
tricky.
round like that, and you have to be able to get your injection in that. And if it's around here, how do you get it? You can't get it if it's down here.
So you can't turn that needle into a circle.
No, you can't. So it might take 2 days to do it, but at
Excellent.
least you're improving all the time.
And the pain does begin to get better, yeah.
Gets better immediately.
Okay. All right, we got another question. Daniel from New York City writes, he works for a sanitation department of New York City. I got a cousin that works for them. And he's been diagnosed with gout. Now, it's funny because people know or think they know what gout is, right?
Right.
And of course, he goes on and on and on. I understand you can't cure gout, but the pain is really, really bad. I was wondering if you could do something to help me.
Yeah, that's, the pain is from a ligament structure, like all pains. The gout is inside, not in the ligament structure where the pain is, so that's treatable.
So when you treat the ligament, it doesn't. Does it get rid of the gout?
It doesn't have to. You just get rid of the pain.
Oh, I see. Now,
Gout is diagnosed by blood work
Yes.
primarily.
And there's crystallization that happens.
Yeah,
in there.
well,
It
yeah.
looks like pieces of glass. and all
I've
that
never been impressed with that. See, they're imagining that the crystals, the glass is pinching you. That is not true. The pain is always from the ligament structure around the joint, not in the joint.
stuff. So if you take care of the joint
Joint capsule.
capsule,
Yeah.
then even though you have the gout, it won't hurt.
It won't hurt anymore. No.
Would there be inflammation still, because your feet get like real big?
No.
Really?
Once you take it out, it's gone. It's not coming back.
I like that. 561-381-5800. If
Yeah,
you have
the
gout,
big toe is
The big toe.
what you always think about. But the big toe has a capsule around it, a ligament structure. That's
yeah.
what you treat.
Well, the funny thing is that when you have gout, it's like forever. It's horrible. People walk around for months with
But
that
they
stuff.
don't have to. They're going to a rheumatologist who's treating blood work.
Yes.
They don't do musculoskeletal work that we do.
Dr. Iha, are you getting this?
Yes, I'm writing everything down.
Is this unbelievable?
Crazy.
Here I am thinking if you have gout, you're going to be crucified for the next few months because it really hurts. I got a guy who's had it for 2 years.
No need to have it for 2 years. All
He
that
can't
pain,
walk anymore.
All that pain is treatable.
Amazing. Every time I meet this guy.
You see, here's the thing, how to think about this. All right, you diagnose it with blood work,
Right.
but the blood work is not causing you a pain.
They say it is.
No, it isn't.
They say it is.
Yeah, they say. But blood work cannot cause you a pain.
Right.
It has to come from structures that cause pain.
Right. That's when they said they had the glass and.
That's what you treat.
Okay.
Okay? So you have to separate sides. That's why I tell people all the time, you're responsible for your own health. If you don't learn more about it, shame on you.
You getting this?
Yeah, it's always worth going and getting a second opinion or finding someone that
It's not a
has
second
a better
opinion.
idea.
You have to diagnose yourself. You have to investigate things.
Well, the funny thing is that if they diagnose you with like gout or something else, you have to be astute enough to say, I'm going to go see Dr. Pannozzo and ask him.
Exactly.
I mean, that's what I would do. Forget about everything else. I would ask you.
So you're diagnosed with blood work, and same thing with rheumatism or
Rheumatoid arthritis.
rheumatoid arthritis. It's diagnosed with blood work.
It's funny you say that, Doc.
And then where's the pain coming from? It's not the blood work.
Well,
I mean, I've seen people really get crooked and scarred down with this stuff, and it's all treatable on the outside.
Yeah.
That's the kind of work we do.
What-
But they're so wary of doing anything because it hurts, especially women. Ugh. They protect themselves. You can't touch them or anything, which
No, you
is
can't.
wrong attitude. You got to go after these things, and you can't do that because you end up being scarred down, not moving, and you don't want that.
That's what you want to stay away from.
Yeah, right?
Jackie from Atlanta writes, Doc, exactly what you're talking about. I have been diagnosed with psoriatic arthritis syndrome. Psoriatic arthritis
I'm
syndrome.
not too sure that even exists.
I don't know
See,
what that
again,
is. In her Achilles tendon.
No, that cannot be.
Can it be in the Achilles tendon?
No,
Right behind her heel.
no, that's something else. See, these are terms put on by the doctors who work in that field, but they don't have the answer to it. If you say psoriatic arthritis, there's a golfer who's made a fortune on
Fortune, I
that
seen
with
the
a
commercial.
thumb.
Yeah.
I mean, that thumb was treatable a long time ago, and he's still doing this. And you can't be. Pain does not come from blood work. It comes from the structures that cause pain, which is ligament.
And she also goes on to say that the area is swollen and a lot of pain and red. Can it be
Yeah,
an infection?
well, that's treatable, sure.
It is treatable.
Yeah.
Now, does that? I remember when I came to see you, you said the area wasn't warm, and you put your hands in where it bothered me, and you were looking for something. What were you looking for?
I was looking for turgor. I was looking for a swelling of the ligament structure and heat.
And that wasn't there.
no.
And if it is there, is that an infection?
No, it's just an inflammation. And infection, you could tell the difference if you see it.
See, so questions I didn't even ask. He says, I'm going to put an injection in there. Says, give me a pillow to bite on. That was done. Done. I would have loved to see Les. Les didn't tell me he was getting shot. I would have loved to have filmed that. All right, we got Jojo from Miami writes, love hearing and seeing your show, Doc. I have a question about a hip flexor injury I have. Hip flexor.
1-day treatment.
He was told to keep his feet elevated to relieve the pain and inflammation. Ice,
no,
injury, hip flexors to relieve the pain. So we're going ice and compression again.
No, you never want to do that. You want to go after it and get it. And that's what we do for you. 1 day is all it takes.
Now, the Mayo Clinic said to him, Mayo Clinic, ice will slow the bleeding of torn muscle fibers and prevent more swelling. For his hip flexor.
That doctor is imagining things.
Isn't that kind of scary?
Yes, he's probably got a very good imagination.
But this is the way they're treating hip flexors. Now,
Yeah.
what is a hip flexor, Doc?
It's just a tendon that lifts your leg up, that's all.
And it's in the hip, obviously.
That's not in the hip, it's below the hip.
It's below the hip, so they call it a hip flexor. Getting
Yeah,
this?
it's a hip flexor. A flexor means decreasing the angle of extension. So extension is straight, flexion is bent.
In the NFL, you sit 2 weeks for a hip flexor.
Oh no,
It's 14 days.
One day. That's what Les had. Les keeps talking about that.
There's a groin injury, Les.
That's what it was, but it was a hip flexor.
It was a hip flexor.
Yeah, it was a hip flexor.
Wow. And that's treatable with one visit. Because that's what you did with him.
Yeah. We do it every day, 2-3 days a week.
I can see that.
Yeah.
All right. I can see that. Sarah here in West Palm Beach writes, I finally saw your show last week and was excited to call in, but I didn't get the number. Please give it out today. So it's we're gonna give Sarah your office number, 561-381-5800.
Yep.
She has flat feet and her ankles and feet always hurt at the end of the day. Could my pain be part of something bigger than the flat feet? And if you answered this before, please don't think I'm a dumb person for asking. It's the first time she's watched the show.
No, if you have 2 flat feet, you could have a leg length deficiency.
What does that mean? Oh, that's what I got, Doc.
Yeah, one leg longer than the other due to injury during the growth area between 12 and 18. That's when these things happen, and but you're able to survive all that because you can. But as you get older and older,
It
you
hurts.
get stiffer and stiffer,
Yeah.
and you're hurting and hurting. So then you have to take care of it. But that's how it happens.
You know, that's me. You just labeled me. You just said me.
Yeah.
Because I have flat feet, one leg longer than the other.
Right.
And man, I'm 54 now. It gets tougher and tougher.
So if you go to a podiatrist, they'll sell you $800 inserts.
They tried that.
Wrong.
Then they tried to cut my left knee open. I said, we ain't doing that
Oh
either.
my God, no!
We're not doing that
terrible.
either.
Oh, I'm sorry.
No, I'm afraid of blades.
Yeah.
5 minutes already? Are you sure? Doc, the show's almost over. You have something you want to share with us?
No, I was trying to find an article in here. There's exercises. I've never seen this in the golf magazine, but they're talking about exercises for the golfer. This is Golf Digest. I might write an article for them. Put
What
them
does it
straight
say
on
about the
exercises.
exercise? What's it say?
Well, it's Johnson's workout. Tried a medicine ball throw. That's not going to do it. And
You know,
so I haven't read the article yet.
but you know, the funny thing about exercise for golfers is that you have to be able to do it.
If you're painful, you're not going to do it.
That's my point. So if you want to do all of this extra stuff, that's great. But if you can't tie your shoes,
Actually, that brings you to the stiffness. And people want to do exercise for that, stretching. But remember, if you have a problem stretching, you have a pain to treat.
that's right.
And so first thing you want to do is raise your body temperature so you can play. And you do that with push-ups and sit-ups and squats.
Interesting.
And your body temperature will come up and the pain will decrease. And then you can play until you cool off again and all that pain comes right back.
You know, Doc, we got 4 minutes left, but it's really interesting also that there was an injury on the New York Jet football game because I was watching, right? And the guy could not lift his arm above his shoulder, and they said that he had a burner or a stinger, is what they call it. You know what a stinger
What
is?
that?
A stinger, nobody really knows what it is. It's like what Mark was saying about his wife. They're going to take care of this by numbing you, and then miraculously you get well. But a stinger is shoulder pain from tackling somebody, and something happens in your neck area to your shoulder, and you can't lift your arm. He's going to miss the next game because of a stinger. Which means you probably can go in there and take care of it in one visit.
Well, we'd examine the neck and see if it's from the neck. And
Nobody knows where it's from.
Well, we could tell. And then the shoulder. And wherever it's from, we would treat that, and that pain would be gone.
Excellent. Well, listen, New York Jets, if you're listening, I love you guys. Call the doc, 561-381-5800. His name is Henderson. Henderson, you don't need to miss any time in practice. You can fly down here, fly back up, and you're done. Also, I want to tell people that Dr. Pannozzo's app is available at the Apple Store. Pannozzo, PANNOZZO.TV. Download the app. You can see all sorts of good stuff in there. And your book is available in there.
Yes. What about the Spanish book?
They're reading it.
They're reading
They're
it.
reading it. They're letting us know you may have to write some stuff. We need to talk about that. I didn't push it because there's a lot of stuff going on. But anyway, want to thank Dr. Pannozzo for spending another wonderful afternoon with us today. 561-381-5800 is his number. Dr. Ihart, thank you very much.
Always a pleasure.
Les, we hope you're doing well, buddy, and hope to see you soon when you get back. Any final words, Dr. Pannozzo?
Have a great afternoon. The sun's out. Get some suntan. That's what I'm going to do.
That's right. Go have some fun in the sun. All right, listen, we'll see you guys next week. Thank you for listening in.